This discussion on price transparency brings us to an interesting question. The big fight: hospitals versus the insurance companies. Who will win the fight and who is right? For a while now, insurance companies always keep complaining and are shocked that hospitals keep increasing reimbursement pricing from 10 to 40% when they have pressure from their members to rein in premiums. The fact that the information and knowledge asymmetry between the doctors and the medical profession and insurance companies, leading to the trust deficit, obviously doesn't help. We saw that there is a growing existent trust deficit amongst citizens, especially regarding hospitals and concerning the pricing information and the transparency of the same. This trust deficit extends to other players in the ecosystem, including governments, regulators, and the others. I sense an opportunity for insurance companies if they are sensitive and alert to this situation. It is likely that they could seize the opportunity and dramatically change the landscape such that the bargaining power shifts from the hospitals to the insurance companies. But for this to happen, the insurance companies will have to invest heavily in consumer-facing technology, empower the widespread adoption of healthcare shopping platforms. Simultaneously, they must encourage hospitals that are willing to publish and promote pricing transparency instead of the ones that would like to keep it arcane and mysterious. Insurance companies could also lobby with governments and regulators to enhance the power of government and federal mandates to increase pressure on hospitals to comply. This could lead and unleash a new wave of innovation, and the impact can be profound and very long term. And therefore, this leads us to the question that I started this slide with. If all of this were to happen, who will win this fight and who is right? Firstly, this is a difficult question to answer unambiguously. And also, insurers and healthcare providers must remind themselves that they have a shared interest in making sure that medical treatment is better coordinated. This will reduce cost for hospitals and will also reduce the premium pressure that insurers have. Chronic inflation, constant clinical labor shortages, and other challenging macroeconomic conditions could propel further increases in healthcare costs over which both parties could do little. This could lead to higher out-of-pocket costs and higher insurance premiums for patients. And as all this happens, hospital pricing will continue to be an area of focus for politicians and economists in the years to come. With this pressure from the regulators and the government, hospitals will have to become more flexible and willing to look closely at efficiencies to reduce the overall burden of healthcare costs. And I think pricing transparency will probably help resolve the asymmetry in rate information by requiring both the insurance companies and the hospitals to publish rates, and also require the insurance companies to provide portals that patients can access to estimate out-of-pocket expenses, compare outcomes, compare costs for similar procedures across hospitals and across regions. This should also allow the ability for consumers and patients to choose and switch between providers and clinics. With all of this, in a flux and unfolding as we speak. If I were to pick sides, and assuming nothing changes with hospital behavior on pricing, my bet would be on the insurance companies. Because as the market matures and insurance penetration increases, insurance companies have a natural advantage because they can control both patient flow and payment flow. It's going to be fascinating how all of this will play out, and doctors cannot remain isolated from these crucial matters. With a basic understanding of hospital economic essentials, doctors must actively influence and determine how pricing policy unfolds and gets implemented. This leads me to wonder, are there ways we can tweak our payment models to hospitals and even to doctors that might change the way hospitals behave? We will shortly get into payment models that are in vogue, the emerging new payment models, also called APMs, alternate payment models. But before that, just a quick look on how pricing transparency is unfolding in emerging economies with a special focus on India. Up next.